Great. Thank you so much for having us today and hosting this important program. We're going to talk for the next few minutes about how to protect yourself from Medicare fraud. So I'm going to cover the program that I am a part of and then also talk about some of the current Medicare fraud schemes that are impacting people right here in the state of Wisconsin, and share some tips for you as far as how to protect yourself from those schemes, and then also share some available resources that we have from this program that might be helpful to you. So again, just briefly, I want to say thank you to Melody and the North Shore Library for hosting us today. We're certainly happy to do that. Before I get started, I did place a link in the chat box, which is for a survey. If you would be so kind or have time to take that survey after this presentation, it's something that our funders just ask for us to share with folks just to get some feedback about our education and outreach activities. So again, that link is in the chat box. If that's something that you're willing to do for us, we would appreciate it. So just again, a highlight of what we're going to talk about today. We're going to talk about the Wisconsin Senior Medicare Patrol Program. I'm going to give you an idea of what that looks like here in the state of Wisconsin, as well as across the United States. We're going to talk specifically about Medicare fraud, what we're seeing in the state of Wisconsin from Medicare beneficiaries, as well as providing some information about how you can protect yourself from Medicare fraud, some ways that you might be able to detect if Medicare fraud has potentially happened to you, and then provide you with some ideas and options for how you might go about reporting if you have concerns that there might be some Medicare fraud happening with your Medicare benefits. I want to spend a little bit of time just talking about COVID-19 related scams and fraud. You might think, well, Ingrid, we're kind of heading out of that, but as you'll learn, there are some things that the scammers still have up their sleeves as it relates to COVID-19. So I certainly want to share that with you. And then, as I mentioned, we'll talk about some resources that we have available to folks as well. So first of all, what is SMP, or the Senior Medicare Patrol? We are a federally funded grant program that is funded through the Administration for Community Living at the federal level. And as I mentioned, the Senior Medicare Patrol program is housed in all 50 states, as well as the 4 United States territories. The program in Wisconsin is housed at the Greater Wisconsin Agency on Aging Resources, which, as I mentioned before, is also known as GWAR. And GWAR is a statewide organization that provides technical assistance and program assistance to all of the aging networks throughout the state of Wisconsin as it relates to the Older Americans Act money that comes from the federal government to the state of Wisconsin to support important programs for older adults like congregate meal sites, transportation programs, family caregiving programs, and a whole host of other programs. So that is where SMP resides in the state of Wisconsin. As far as the mission of the Senior Medicare Patrol, it's really quite simple, as you can see here on the screen. The mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So that tells you who we work with and who we interact with, what our message is, and then how we go about doing that. So outreach, in a normal time, that does not include a global pandemic, you would find us at lots of community resource fairs, health and wellness expos, other events that libraries or aging and disability resource centers or senior centers or other organizations put together in the community for older adults. You would find us there at tables with our information, interacting one-on-one with folks. We haven't been able to do that for a while, but as I was sharing with Melody earlier, we're looking forward to being able to do that again in the very near future. The counseling that we provide is done via our toll-free helpline, and all of that information will be available at the end of this presentation. But we do operate a toll-free helpline that folks can call during normal business hours, Monday through Friday, to report concerns, to report fraudulent or suspected fraudulent activities, to ask questions about maybe bills that they've received from a healthcare provider, to schedule a presentation. The list goes on for why you could call us on that toll-free helpline. And then lastly, education. So opportunities like this in the virtual Zoom world, and then also in person as well, as an opportunities for us to share our message, provide some tips, and again, interact with folks individually. So now that you know that there is a Senior Medicare Patrol program, maybe you're wondering why it's necessary. Oftentimes people are shocked with this next estimate that on an annual basis, the estimate is that it's billions, that's billions with a B, and the current estimate is between 60 and 100 billion dollars are lost to improper claims on an annual basis, just with the Medicare system. So I don't know about you, but for me, that's a number I can't even fathom. When I joined this program, I kind of thought that was maybe a high estimate. That didn't seem like it was real. But then I started to see Medicare summary notices with suspected fraudulent charges on there, and could see very quickly how those dollars do add up to the billions on an annual basis. So that's why we have this program. The Senior Medicare Patrol program was started in the late 1990s. It was intended to be very grassroots, relying on volunteers in the community to share this information with fellow Medicare beneficiaries, providing them with tips and tricks about how they can protect themselves from this happening. And from those very initial ideas, the Senior Medicare Patrol program was started and continues today. And we do make a difference. While we aren't able to match dollar for dollar the billions of dollars that we are able to recover to the Medicare program because of fraudulent claims, we do play a pretty significant role in that, and that's something that we're very proud of. What does this fraudulent activity mean for Medicare beneficiaries? Unfortunately, higher premiums. We all know that the cost of healthcare in general continues to go up, and similarly with Medicare beneficiaries, most years when you receive information about the new premium amounts, etc., for the following year, more than likely they are higher. So we're just really hoping that we can continue to have a positive impact in recovering dollars to the Medicare program, but more importantly, preventing the fraud from happening in the first place. So we're going to talk a little bit about what we're seeing in the state of Wisconsin, seeing and hearing directly from Wisconsin Medicare beneficiaries. Now, when I joined the program, I already shared with you I was a little bit skeptical or hesitant about the billions of dollars. I thought that was kind of a little bit too high, perhaps. I also, maybe a little bit Pollyanna-like, thought that there was probably not that much fraud that impacted folks in Wisconsin. We're all great people, we're friendly, we look out for each other, so there's probably not that much Medicare-related fraud, errors, or abuse that happens in Wisconsin. Well, unfortunately, I was very quickly shown that that in fact is not the case. And Medicare scams are happening to people in Wisconsin on a daily basis. I hope that folks here in the audience are not on that list of people, but if you are, hopefully this presentation will be helpful for you, and that you'll know that there's now a resource that's available for you should you have questions, concerns, or need additional help. So let me talk through, I would call these, the first two here, new Medicare card scams and durable medical equipment scams. I would call those probably the top two most reported concerns on our helpline right now. The third thing that I've listed here, cardiac genetic testing, that's relatively new. So I want to spend a little bit of time talking to you about that and letting you know what that scam looks like, so that if you should receive this telephone call or see information out and about or receive a mailing about it, that you have some information to know that it's likely a scam and how to protect yourself from that. So the first one is the new Medicare card scam calls. So there's been reports across the country, including here in the state of Wisconsin, that companies are calling folks saying they're calling on behalf of Medicare to make sure that they received their new Medicare card. Sometimes this call accompanies a conversation about COVID-19, stating that because of COVID-19 and the pandemic, Medicare made the decision to issue new Medicare cards because of the new benefits that it was providing as a result of COVID-19. Here's the scoop on that, not true. The other calls that people receive or report about new cards talked about there being a plastic coated Medicare card that people needed to have or that could be available to them, or that if they verified, you'll hear me say that often, that's a buzzword, verified someone's Medicare number, they would send to them a laminated card. Also not true. So here's what's real about that. Medicare is not issuing new Medicare cards right now for any reason. So if you're a Medicare beneficiary, the paper Medicare card that you have that looks similar to the card that's shown here on the screen, that's it. It's not fancy. It is red, white, and blue. It's paper. It's not plastic coated. It's not laminated. It doesn't need to be. It's just your paper card from Medicare. That's your Medicare card. There's nothing that you're missing out on. There's not another option. If someone calls you asking if you've received your new card, my advice to you would be to simply hang up, because what they're looking for is that they're looking for you to verify your Medicare information. So for example, this card here on the screen says John L. Smith. So fraudster is calling John to say, hey John, I'm calling on behalf of Medicare. I just want to make sure that you received your new Medicare card in the mail. Want to make sure that you have that most up-to-date information in case you would need anything with your Medicare benefits. And of course, John says, well, no, I got one a couple of years ago that has my new number on it, but no, I haven't received anything recently. Well, then they're going to say, well, John, I'd be happy to take care of that for you. It's really important that you get that new information. Just need to verify your Medicare information so that I can get that out in the mail to you. Well, once they have your Medicare information, which you will hopefully understand as we continue to move through this presentation, the sky is the limit for the fraudsters as it relates to claims that they can submit to Medicare fraudulently, obviously, with your information. So that's truly what they're looking for. They are not going to send you anything new. They have nothing new to send you. They're just looking for that new information. So again, the reminder, no new Medicare cards. About 2 years ago, Medicare did undergo a complete rehaul of all of the cards for all Medicare beneficiaries across the country. And you may remember that the card number is no longer your Social Security number, which is great, as it is another step to prevent identity theft, as you would be sharing that information. And the number that you have now is now a randomly generated alphanumeric number that you probably won't be able to memorize because it won't necessarily make sense to you to memorize that. But you did get a new card at that point. There's no new cards in the pipeline for that. And if there were, Medicare would be reaching out to you directly via the United States mail, or if you're signed up to receive updates directly from Medicare, Medicare.gov, their website, via email, you would hear directly from them that there was going to be a new card issued and what that timeline looked like. So heads up for now, no new Medicare cards. So if you get a call about that, or a friend, you hear a friend talking about that, please let them know that that is in fact a scam and that there are not new Medicare cards on the horizon. The next one that I want to talk to you about is durable medical equipment scams. So durable medical equipment in this situation means back braces, knee braces, ankle braces, wrist braces, and the list goes on and on. For whatever sort of ailment you might have, these companies seem to have the perfect brace for you. Oftentimes when I'm in a person for a presentation and I'm talking about durable medical equipment, and the phone calls or the television commercials that people see with this best ever back brace that's going to cure you of all your troubles, people's heads start to nod because they themselves have received numerous calls, or this call, or they have friends or family that have received calls similar to this. So again, These phone calls typically start out with, you know, I'm calling on behalf of Medicare. Just wanted to know if you are experiencing any. They usually start with back pain. Unfortunately, back pain is pretty common among the Medicare beneficiary age group. So as you're talking with them, you may say, yeah, you know, sometimes I do have some trouble with my back. And then they're going to jump right into the next thing, which is going to be, well, we want to make sure that you have access to this free, that's a buzzword here, free. Everyone likes free stuff. My warning to you is, if it seems too good to be true, it probably is. And unfortunately in life, there are really not any things that are truly free. So there's usually some strings attached. And in this case, there certainly are. So they're saying it's free, Medicare is going to cover the whole cost. Again, just need to verify your Medicare information and we'll be sure to get you that Medicare or that brace in the mail as soon as possible. Okay, so before I go on with what this scam is all about, I do want to say that Medicare, in fact, does pay for this sort of equipment. This sort of equipment is covered by Medicare when it is ordered appropriately by a treating physician. So you have to have a doctor's order for these things. It has to be from your treating physician, someone who actually had their eyes on you in a clinic or via telehealth. They did make some adjustments to those requirements during the pandemic so that people would continue to seek medical attention if necessary. But Medicare will pay for those things when done appropriately. I also want to say that in some cases, these back braces or knee braces or whatever sort of brace it is are extremely helpful. So this is certainly not a slam on back braces, knee braces, those sorts of things. They are helpful. My suggestion to you is that if you've seen this commercial on TV late at night, when maybe you haven't been able to sleep because your back is bothering you, instead of calling the 1-800 number on the television screen to get more information about that, I'm suggesting that you would talk directly with your healthcare provider about that. The reason being that if you contact that number on the TV screen, you are inadvertently, even though they're not going to ask you this, you are giving them permission to call you relentlessly. And if you don't know this already from your own personal experience, they can be relentless in the calls that they make to folks. And they also share your information with other similar companies to them. So that's just going to expedite the number of calls that you're going to get. So instead of making that phone call, make a phone call to your healthcare provider. So what happens in this situation? So let me share a real world experience. I had a gentleman call from, I don't remember where in Wisconsin, it doesn't matter. And he was so frustrated. He said, ma'am, I have received 6 boxes of equipment on my front porch over the last 2 days, none of which, except for one thing, did I ever order, talk to anyone about. My doctor knows nothing. And I said, okay, so let's back up a little bit. What happened? He did say that he called the television commercial, 1-800 number, for a back brace and shared his Medicare information. And what happened after that is that he did get the back brace from that company that he reached out to, but he also got several more boxes of additional braces of all sorts of shapes and sizes for different body parts from a number of other suppliers or companies that provide durable medical equipment. He was so frustrated that before he contacted anyone, he packaged up all those boxes, took them back to the post office, sent them all back to wherever it was that they came from, ended up spending over $200 out of his own pocket to send all of those things back. And then he received his Medicare summary notice to see that these companies had charged or submitted claims to Medicare. And in adding up all of those things, it was in the $20,000 range for those braces. He was furious. And so we worked together to pull all of the pieces of this issue together. And then because he was connected with the Senior Medicare Patrol, because of our connection at the federal government level, I am not an investigator. My role is to collect information and document it and collect all the relevant documents to go along with that. And then we submit all of the suspected fraud cases that we come into contact with to the federal level, to the Office of Inspector General. At that level, that's where the investigation happens. And they take over, and you probably maybe have heard some of the takedowns that have happened at the national level as it relates to durable medical equipment scams, as it relates to telemedicine scams. There have been some recently as it related to COVID-19 scams. At the federal level, that's where the courts get involved. Doctors lose their licenses. Companies are needing to pay restitution. Companies go out of businesses. People spend time in jail. All of the things, because you know what this activity is illegal. And so if you are someone who has boxes of stuff sitting in your hallway that you're not sure what to do with, or if you know of someone who has, you share our information with them. We will work with them to get rid of that get rid of those equipment, make sure Medicare didn't pay for any of that. And if they did, work hard to make sure that that money gets recovered to Medicare. So again, be careful. If you do think that you need this type of equipment, reach out to your healthcare provider to have this conversation with them. Then the last one that I want to talk about, as I mentioned, it's a little bit new. It's called the cardiac genetic testing scams, kind of a new twist on an old scam. The old scam was specific to genetic testing or cancer screening. In this new version, they've added cardiac to the name of what they're doing. And what that looks like from the reports that we're hearing are that people are getting calls from random people, some of them stating they're calling on behalf of Medicare, others stating they're just calling from some sort of a cardiac testing equipment company, but they're calling and asking if you have cardiac issues yourself or in your family. Now, again, unfortunately, most people probably would answer yes to that, which is the fraudster's dream, because then they can continue on with their script. And what their script leads you to believe then is that they're recommending that you obtain a DNA test kit so that you can learn more about your risks for cardiac issues, not only for yourself, but for your other family members. And wouldn't you know it, so conveniently, they are able to get you in contact with that test kit by just verifying your Medicare number. There you see that word again, verifying. So the cost will be covered by Medicare. They're going to send you the test kit in the mail. There'll be instructions about what you need to do and how you do that. And usually a quick cheek swab, you put it back in the packaging, send it back, and then a doctor is going to follow up with you after he or she reads the results of that test, and we'll take the next steps from there. So a couple things here. The main thing, here's the catch as it says on the slide, Medicare does not cover a cardiac genetic test except in very rare circumstances. Similarly, Medicare's guidelines about genetic testing in general and cancer screening are also very specific. So this is not something that Medicare would generally cover. What does that mean? That means that if you have verified your Medicare number so that you can obtain a DNA test kit of this sort, depending on what sort of claim is filed with Medicare by this company, if that claim is denied, meaning that Medicare is not going to pay for it, which then would mean if you're someone who has original Medicare, if Medicare didn't pay their portion, your supplemental insurance company is not going to pay their portion, then the potential is that you, the Medicare beneficiary, could be on the hook for the dollar amount of this test. So that's not something that you are going to want to have to pay for. And again, if you have concerns about cardiac issues, chances are you've already had conversations with your doctor or cardiologist or whomever that might be about your specific situation, and you will work with him or her to make sure that the appropriate tests have been ordered for you and that things have been documented appropriately so that in fact Medicare will cover the cost of those tests. So again, be careful. These calls are out there. I spoke to a gentleman in northern Wisconsin about 2.5 weeks ago. He shared with me on one day that he got this call and that he was, they asked him about cardiac issues, and it seemed legitimate because he in fact had just been at the doctor with some cardiac issues, and in a couple of weeks he was having a full cardiac workup done. And so I think that what happened is that he shared this information with the person, the fraudster ideally, who called him, that they were like, this is the best thing ever. So they had him completely convinced that this test kit that they were going to send him was something that his doctor had required and ordered that he do and take care of prior to his upcoming full workup visit. So he dug for his Medicare card, shared his information, and wouldn't you know, within about 2 days, he did receive that kit. And then the phone calls came because they were insistent that he hurry up and get that returned, and that he needed to get that sent back as quickly as possible. Well, fortunately, we intervened. We threw away the test kit. We captured all the information first. We asked for that company to not be calling him again. And we then worked with Medicare and submitted this information to the Office of Inspector General so that they can investigate this company that was acting fraudulently and sending out these cardiac genetic test kits for no reason but to claim Medicare funds that they didn't have coming to them. So just be very cautious. We're going to talk a little bit later about the telephone and how we have to be so careful. So this is one of those cases where we have to be so careful. So what can you do? Now we're going to kind of switch gears a little bit and talk about some tips for how you can follow these 3 steps to protect, detect, and report suspected Medicare fraud. So the first thing, this has to do primarily with the telephone, because most of the time people are contacted via the telephone for all of the scams that we've talked about. So my number one thing is going to be, first of all, if you have caller ID and you see on the caller ID it's a number that you don't recognize, just simply don't answer it. Let it go to voicemail. Most of the time those companies aren't going to leave voicemails. They're calling probably thousands of people at the same time, and then if someone picks up, then they figure out their computer system to answer that phone call. So if you do have caller ID, just screen your calls as best you can. And I know that the fraudsters have software where they can change their number so that it looks like it's calling from a local number that you would maybe recognize, or you don't completely recognize it, but you recognize the area code and maybe those next 3 digits, the exchange, as being from your local community, that you think, oh, well, it's probably someone local. And then in fact, it ends up being the fraudsters. So just be really careful on the phone. One thing to remember, to hang up if the caller claims to be from a government agency. So government agency meaning Medicare, the Social Security Administration, the Internal Revenue Service. These governmental agencies are not going to call you unless you've initiated a call to them first. So if someone's calling and saying they're calling on behalf of Medicare, that's a red flag. They're hoping that you're going to believe that they're calling from Medicare so that you'll share information with you. Hang up the phone. If you're wondering after you hang up the phone, if you got a phone call, we get a lot of calls that say, I got a phone call that said that I needed to call Social Security back, or I needed to return this phone call at this number because my Social Security number was being used in Texas, and if I didn't call back quickly, who knows what was going to happen. Hang up the phone on those instances. That they should not. Medicare, Social Security, Internal Revenue Service, if they do need to call you, or if they are returning a phone call to you, they're certainly not going to be threatening in any way to you. They are going to work with you to resolve whatever issue it was that you brought up to them. So I guess what I'm trying to say is, if someone calls you and says they're calling on behalf of Medicare, hang up the phone. If that seems like, I wonder if Medicare really was trying to call me, my suggestion to you would be to initiate a call directly to Medicare yourself. You can call the toll-free number. It's 1-800-MEDICARE. That number is on the back of your Medicare card. And you can call and say, you know what, I just got a phone call. They said they were calling on behalf of Medicare. I just wanted to make sure I didn't miss any important information. 99.9% of the time, the customer service representative that you speak with at 1-800-Medicare is going to say, no ma'am, or sir, Medicare is not making phone calls to Medicare beneficiaries about anything. I'm so glad that you hung up that phone. That was likely a fraudster. Thanks for double checking. You did the right thing. The phone call is ended. You can feel good that you're not missing anything and that you didn't share any information with them. So again, remember, the government folks, they're not going to call you. If they have questions about your account or your benefits, they are going to reach out to you via the United States mail to send a letter that says what the questions are, what the concern is, and then provide you with instructions about how you would reach out to them to get those issues resolved. Hang up the phone if the person on the other end, who is someone that you've never talked to before, is asking for sensitive or personal information. I don't know about you. I mean, I hardly ever answer my phone because most of the time it's trouble, and I seem to need to stay away from that trouble. I'd rather not have to deal with it. But if someone's asking you for personal information, I would say that's a red flag, especially if it's someone that you're not familiar with. You just hang up the phone. And I know that we've all been taught to be polite on the phone and that it's not polite to hang up the phone, but I'm here to tell you that it's completely polite for you to hang up the phone, because the activities that the fraudsters are attempting to do with you on the phone are certainly not polite, and they're going to cause you a lot of headaches in the future. Much easier to simply hang up the phone and go about your day. Now, some robocalls that you may receive, maybe they've given you, maybe when you answer the phone, there's a recording on there that gives you, to speak to a customer service representative, press 3. To opt out of receiving phone calls, press 9. That sounds great. Like, oh my gosh, they're telling me how I can get out of this circle of these phone calls. Well, unfortunately, that's part of the scam. And pressing 9 is only going to probably add your name to the call list that many more times. So if there is a recording when you answer the phone or a similar voicemail that's left, hang up the phone, delete the voicemail, no interaction with these folks. Because if you let the phone ring and ring and ring and ring and ring, or there's never any interaction with the company that's trying to call you, eventually, now I will say eventually could be weeks or months or years, but eventually they're going to stop calling you because they're going to realize that that's not a live number. Even though it is, you're just doing a really great job of screening it. If you pick up the phone or you continue to interact with the callers each time they call, they know that it's a live number, they know that someone answered, and they know that they were close the first time to get you to share whatever information they were looking for, so you can bet that they're going to keep trying. Bottom line here, please do not share personal information over the phone with pretty much anyone, unless you know it's your clinic or a pharmacy, as we're talking about Medicare information. But most often you have shared that information in person at a visit. They have it in your medical record, and that's not something that, unless your Medicare information changes, that's not something that they should have to ever ask for you for that information over the phone. And if you're skeptical, if there's any reason in your head that you think, oh, I don't know if I should do this, take a time out. None of this has to be done immediately. You can ask the person if you could call them back. You could say that you need to talk to someone else before you share this information. If you're not comfortable just simply saying, no, I'm not sharing that, but just take a deep breath before you share that information, because once you've shared that information, it's really hard to get it back. So people often ask me, well, how do we get rid of all these calls? I mean, I'm getting 10, 15, 20, even sometimes more calls all day long. They start at 8 in the morning. They don't finish until 10 at night. It's harassment at some level, and I certainly understand that. Unfortunately, I don't have a quick fix for this. I can offer some suggestions for you. One of them being to make sure that your telephone number or numbers, if you have a home telephone number as well as a cell phone number, that all of the telephone numbers for you are registered on the National Do Not Call Registry. Now, I know that this is not 100% foolproof, and some people even chuckle when I make this suggestion, but it's better to have your phone number information registered than not registered. So if that's something that you haven't done, or maybe you want to double check, here's the website that you can visit to see if your number is on that do not call registry, or to add it if it isn't. And this is a way to cut down on the number of telemarketing calls that you receive. Unfortunately, not everyone follows the rules, and unfortunately, many of these fraudsters figure out ways around it, but in some instances, it does at least reduce some of the phone calls that you're getting that you would prefer not to. They also have a mechanism on that website where you can report unwanted calls as well, and they are working hard. This is run through the Federal Trade Commission at the federal level, and they are working hard on legislation to impact telemarketing calls, robocalls, all of those things. Another suggestion would be to contact your phone carrier to see if they have blocking services available. I know on my cell phone, I have AT&T service, and several months ago, I noticed that sometimes when a call is coming through, it'll say scam risk on part of the caller ID, or possible fraud, or telemarketing calls. So that is great. I don't even have to wonder or think if I'm going to answer that, because it's automatically telling me this call is probably not something that you want to answer. So double check with your phone carrier. Some of them are automatically offering those services. Other phone carriers may offer services for a fee, but certainly get that information. You can make that decision for yourself. And lastly, as I said, always be careful of sharing information when you're on the phone. So step 2, so we talked about how to protect yourself. Step 2 is how to detect Medicare fraud and abuse. So we all, whether we're Medicare beneficiaries or not, need to be good healthcare consumers. And what that means is that we really need to do our due diligence when we receive statements that are related to our healthcare. If you are someone who is on original Medicare or traditional Medicare, you would receive quarterly statements. These are statements, not bills, directly from Medicare that are called your Medicare summary notices. They will have listings of all the claims that were filed with your Medicare information during that 3-month period. If you are someone who has a Medicare Advantage plan, you receive what's called an explanation of benefits statement from your insurance company. Again, sometimes the time period isn't the same. Maybe it's monthly, maybe it's quarterly. Nonetheless, you would receive from your insurance company a statement that outlines all of the claims that were filed for you during that time. So it's really important to open those and look through them. I know they can be a little bit cumbersome or maybe overwhelming or confusing. There's lots of information on there. If you take a deep breath and start at the first page and kind of work your way through, I think as you get to be more comfortable doing it, it'll be more natural to you. You can also give us a call at the Senior Medicare Patrol, and we can walk through that with you and point out some of the highlights on each of the pages so that you know what you're looking for. But you want to look for, as it lists here, services that you didn't receive. Maybe something's on there twice that that Medicare shouldn't have paid twice, or that there are services on there that are not ordered by your doctor. So you're going to see service dates, you're going to see providers' information and addresses, you're going to see healthcare providers' names, the people that are ordering whatever that service would be. So all of those things on that information should look familiar to you. It's a red flag when they don't. And here's the thing, lots of people don't take the time or don't understand how important these notices are, and they don't look at them. And you know what? That's what the fraudsters are hoping for. They know that they've submitted fraudulent claims to Medicare. They're crossing their fingers and hoping that me, Ingrid, doesn't look at mine, so that when they submit the claims, Medicare's paid for them, I never look at it, I don't ask questions, and they continue on with the next person. So it's just really important to become familiar with these notices and to really look at them on a regular basis each time they come, just to make sure that they're an accurate reflection of your healthcare Medicare benefits. We do have a complimentary tool that's available. It's called our Personal Healthcare Journal. I have one here, just a little booklet, where this is something that if you're looking for a system to keep track of dates and who you saw at the doctor's office, and maybe a really quick, I had blood work done on May 27th and I saw Dr. Smith, then when you receive your Medicare summary notice in the mail, and remember, if you're receiving them in the mail, they're coming quarterly, so it might be a month or two before you would get that Medicare summary notice. I'm not always great at keeping all those dates and the specifics straight in my head, so if I have something that I can use to write it down, when I get my Medicare summary notice, I can open that, I can grab my personal healthcare journal and just make sure dates, doctors, services that were provided match. And that maybe would be helpful for you. Then you can do that more quickly and know that it's accurate or not. And then if there's a question, you kind of know where to start with that. So if this is something that you would be interested in receiving, like I said, we offer them at no charge. You can, I have my information at the end. You can give us a call on the helpline, or you can send an email and we can get a personal healthcare journal in the mail to you. So again, just a tool that might be helpful for some folks. Lastly, step 3, report suspected Medicare fraud and abuse. So what we're suggesting is that if you see something that doesn't seem right, say something, tell someone, ask questions, be your own best advocate. If you get a bill in the mail from your healthcare provider and it doesn't make any sense to you, or you just really need help working through it, if you're comfortable, call the provider. Ask the questions. They have a duty to make sure that you understand all of the information that's provided. Most of the time, it might take a little bit to figure out who the right person at that healthcare system is to talk through that. But if they are acting ethically and following all of the professional guidelines and Medicare guidelines that they have in place, they are going to do their best to provide you with the information that you're looking for. If you're getting the runaround, if no one will talk to you, if they're not interested in hearing your concerns, that might be a red flag. There might be potentially some questionable billing practices. And at that point, you can give us a call and we can talk about what next steps might be. But by all means, be your own best advocate and ask questions, call, tell someone, and don't stand your ground until you get the information that you're looking for. And remember that you can always contact us. If you contact the Wisconsin Senior Medicare Helpline, you're going to talk with me, and I'm just going to ask you a lot of questions. I get a lot of people that leave messages like, hey, I got a phone call. I shared my Medicare number. I don't know what to do. I shouldn't have done it. Please give me a call back. I'm going to call you back. I'm going to identify myself as returning your telephone call from the Senior Medicare Patrol. I understand if you're screening your calls and you don't answer it because you don't recognize the phone number. That's a good thing. That means that you're really screening your calls, and you can certainly give me a call back, or we can schedule a time more specifically to talk. But I will be glad to gather information, provide you with next steps, let you know things to watch out for, who you can call, all of those things. I'm here to help you with that. So again, just remember that we're here to help, and that all of our services are offered at no cost to you and are also confidential as well. And I promise in a few slides, you will see that number where you can reach me. Really quickly, I just want to touch on COVID-19 scams and fraud. I know we're getting hopefully to the end of the pandemic, but what we're always told is that the fraudsters follow the headlines. So anytime there's uncertainty or things that people are unsure of, or there's just uncertainty in general, the fraudsters figure out how to work themselves into that to take advantage of that, and then ultimately take advantage of all of us. And the COVID-19 pandemic was no exception to that. It started off right at the beginning when we were looking at testing, and there was uncertainty about testing. We saw the testing and the home test kit scams skyrocket. Then there was issues that people weren't able to get personal protective equipment. There wasn't enough. Suddenly, all these companies had all of this equipment that they were willing to get to people if they shared their Medicare information or other insurance information. Again, scams. Then we saw fake treatments and cures. You would be shocked. There were creams, there were pills, all sorts of things that were offered, fake, of course, as treatments for COVID-19. And then as we rounded the corner to talk about vaccines, that started a whole host of other vaccine-related fraud. The reason I'm bringing this up is that we're already starting to hear about fraudsters who are making calls to folks, letting them know that it's time for them to get their COVID-19 vaccine booster shots. Now, this may be in the news or hasn't even been in the news. I don't know that anyone knows if we will need to have booster shots for people who've been vaccinated. There hasn't been a lot of information about that as of yet. It very well may be the case that at some point in time we would need to be booster shots for that vaccine, but at this point there is not any information. So if you receive a phone call asking for Medicare information or other insurance information as it relates to a vaccine booster shot for COVID-19, that's a scam. At this point in time, there are no guidelines from Medicare about booster shot vaccine coverage. I would guess that if and when that's deemed appropriate, Medicare will figure out how and when and what that coverage will look like, just as they did with COVID-19 testing and the original vaccines. But at this point in time, that's not happening. So again, just a heads up that this could be a phone call that you would hear or see in the near future. So just beware that that is one of the latest COVID-19 scams that we're starting to hear about. Other scams to be aware of, and the list goes on and on. This is certainly not exhaustive, but the grandparent scam, the romance scam, gift cards, IRS, police and fire, contractor, computer virus protection, car warranty, and on and on and on. Again, bottom line, be careful. A lot of these scams happen over the phone, and similar to what we were talking about earlier with the Medicare scams on the phone, that information is the same. Don't share information, hang up. If you want to support your local police or fire department, call them directly and ask them how you can support them. And provide payment to them how they wish to do it, knowing that you're speaking directly to them. Just be cautious. I hate to have to say it, but we have to be skeptical. Unfortunately, we can't take people at their word. We can't know that people are acting in their own best interest. And that makes me really sad to say that, but they're not. There are so many people out there that are looking to take advantage of us for their own gain. And this list and many others are all examples of that. So we have to protect ourselves, share this information with your friends and family to help them protect themselves so that we can all stay safe and keep our personal information safe, our medical identity safe, our banking information, all of the information. We want to keep all of that safe. One thing before I talk about resources is that I mentioned earlier that the Senior Medicare Patrol program relies on volunteers to help us out in the community. The last year plus has been a little bit quiet for volunteer involvement simply because we've moved to a virtual platform, but we are looking to transition back to in-person events come fall, and we are looking for volunteers to help us all across the state of Wisconsin. We're looking for folks who are interested in helping distribute information and materials, give presentations if they're comfortable, staff tables at events and health fairs. We provide all of the resources, all of the training, all of the information. We have a small but mighty volunteer team currently, and we're always looking to add to that. So if that's something that you think you might want to get some more information about, you can certainly give us a call. We'd love to talk more about that with you. Lastly, available resources. We talked about the Personal Healthcare Journal already. We also publish a quarterly newsletter, which you can see on the screen here is called the SMP Scoop. So again, it's quarterly. We just issued our June publication. Information in here about scams related to Medicare, other things related to Medicare benefits if things are changing. We have a column from the Social Security Administration, the Better Business Bureau of Wisconsin, just all sorts of information that hopefully is helpful to you as a consumer, as well as a Medicare beneficiary, to keep you safe. We also, on occasion, issue fraud alerts. If there's something coming down the pike that we want people to know about, and we're not publishing a newsletter in that timeline, we'll issue a fraud alert. So you can see this one on the screen was issued at the end of last year, talking about COVID-19 vaccines and the potential scams that were going to come with that. We are currently working on a fraud alert as it relates to the cardiac genetic testing that I spoke about just a bit ago. So again, if you're interested in receiving those, let us know. We can send to you paper copies, or we can send to you electronic copies, completely up to you. The other things that are listed here as resources are our toll-free helpline that you can call for pretty much anything that you might want to know or have questions about as it relates to the program. And then also know that we are available for educational opportunities as well as outreach opportunities. So last but not least, before I am quiet, I would like to just share with you on the screen here is how you can contact us for more information. The toll-free helpline number is 888-818-2611. And again, if you call that, you will speak directly with me. I am currently the only person that's answering our toll-free helpline. Similarly, that's our general email box if you'd prefer to send an email. We do have a website that you can see here the address for, and we are also on Facebook. So if you're someone who's on Facebook and would like to follow us, we try to keep people up to date on current scams and reminders about how to keep yourself safe. We also try to share information from other partners across the state as well as the country that are also kind of in the fraud prevention business, the Federal Trade Commission, the Better Business Bureau, and other organizations like that. So at this time, I'm going to be quiet and see if there are any questions or comments about any of the information that I've talked about today.
Great, thank you, Ingrid. This has been great.